Good morning, good afternoon from wherever you're joining us today, and welcome to our webinar today. Our webinar title is Advocating for Mental Health When the World is Watching. Please feel free to introduce yourself in the chat. My name is Joy Muhia, and I coordinate the Mental Health Innovation Network. And today, whenever we talk about International Awareness Days, we always try and put in efforts annually to get behind the specific themes and messages and call to action through different activities. And this is presented differently at different levels, from global to national, and in the different communities, all with an aim to address the needs at these specific respective levels. So, our conversation today aims to dig deeper into the planning and strategic importance of events such as the World Suicide Prevention Day and the World Mental Health Day, and cover strategies needed to effectively leverage the momentum created around awareness days and amplify the impact and reach of local initiatives and campaigns. And joining us today, we have two amazing panelists. So I'll ask them to introduce themselves. So over to you, Akiyama.
Thank you. Thank you, Joy. Hello, everyone. Good morning, good afternoon, good evening. My name is Tsuyoshi Akiyama, currently serving as president for the World Federation for Mental Health. Professionally, I have been working as a psychiatrist for 45 years. Privately, I am a father of a son, my only child, who suffered from schizophrenia at the age of 18. And after 21 years of hard struggle with the illness, unfortunately, he chose to terminate his life. So I am a family too. So I want to work with you all to improve the global mental health to prevent a case like my son. Thank you.
Thank you very much, Akiyama. And so sorry to hear about your son. And it's amazing all the work that you're putting on to be able to still advocate for mental health. Over to you, Rory.
Thanks, Joy and Akiyama. Again, I was really sorry to hear about your son as well. And as we know, sadly, over 720,000 people die by suicide globally each year, and the ripples of devastation are just vast. So my name is Rory O'Connor, and I'm president of the International Association for Suicide Prevention. I'm a psychologist based in Glasgow in Scotland. I'm Irish, but based in Scotland, and I've been working on suicide research and suicide prevention for 30 years.
Thank you so much for introducing yourselves, and you'll get to hear more from our panelists today. I invite all our participants to be able to send questions in the chat as we move along, and we'll ensure to respond to them. So, as we begin, I'd like to ask, as you're the two people who set the agenda for the two key important mental health related days, and I'd like to ask, so what are some of the opportunities that arise around this international awareness days? And I'd like to hand over to Akiyama.
Okay, thank you very much. Um, yeah, International Awareness Day and is important, and also WFMH has organizes a World Mental Health Day. For the day, World Mental Health Day, there will be numerous events worldwide, hopefully enhancing the awareness in the regions, in the countries, and in the communities. Um, but one day is important, but at the same time, continued activities are important, as we all know. So this year, I am asking the members of the WFMH to consider um, organizing events about this year's theme. This year's theme of the World Mental Health Day is workplace mental health, organizing events year long, and from the events, hopefully we can gather reports about various situations in the world so that next year we can create some sort of global report uh, of the from the grassroots organizations like ourselves to report to the all the stakeholders, including the WHO. Thank you.
Thank you so much, Akiyama, for that and emphasizing that despite there just being one international, mental health day, that we should not just capitalize on that one day, but have activities throughout the years. And Rory, over to you.
Yeah, so I would echo that point as well, which is yes, World Suicide Prevention Day happens every year on the 10th of September, but of course, suicide prevention activities have to be 365 days of the year, and actually, what's been really encouraging over the last 21 years now. So, World Suicide Prevention Day, we established in conjunction with the World Health Organization, but the International Association for Suicide Prevention is in conjunction with the World Health Organization established World Suicide Prevention Day in 2003. And what's been remarkable has seen the growth in World Suicide Prevention Day. And for us as an organization, it's an important event here for us. Our key mission is to raise awareness around suicide and crucially its prevention. And actually, if we look at the reach of World Suicide Prevention Day as a phenomenon, it's quite remarkable. So we haven't finished our analysis for World Suicide Prevention Day this year, but if I just give you a couple of statistics for last year's World Suicide Prevention Day. So our campaign on social media last year reached well over 100 million. I think it was 101 million people we estimated it reached last year. And then in the global conversations that happens sort of on the back of World Suicide Prevention Day through news articles or podcasts and videos and other events, there's about 16 million people. So, and one other statistic, maybe also to highlight, is a few years ago in the pandemic in 2020, we launched this video, which we developed in partnership with colleagues around the world, with people who've lived the experience, as well as all of us involved as stakeholders in suicide prevention. It was a video called Step Closer, and it was trying to encourage this message that we all can do something to prevent suicide. And that video, the last time I checked, which was maybe last year, was over 30 or 40 million people. I think it was 30 million at that stage had viewed the video. So it just illustrates that if we can develop resources as we do, the International Association for Suicide Prevention, linked to World Suicide Prevention Day, the reach is vast.
Well, it's amazing to hear how much vast the reach is when it comes to all this, be it suicide awareness, suicide prevention activities, and the World Mental Health Day activities, and that clearly shows there's a need. And in as much as there's a need, there's clearly a wide audience that needs to be reached to, and that we need to ensure that there are different ways we reach to these people. So, my following question would be, how would you envision us using that day for maximum impact? Would there be any strategies you'd recommend, to make meaningful change on these awareness days from your own experience? So over to you, Akiyama.
Thank you. Um, as much as possible, we, all of us, should be one voice. And one voice, obviously, the center is WHO. So WFMH collaborates with the WHO about various action plans and about this year's theme of workplace mental health. Uh, we are planning good collaboration between the WFMH and WHO. However, another important issue is the partner among ourselves. Uh, the stigma, discrimination is all over the world, rampant. However, there are many, many good people, good activities in the world too. And as much as possible, we should partner with each other. And in that respect, I'm very grateful for Global Mental Health Action Network to organize this webinar, allowing me to have an opportunity with Joy and Roy and everyone uh, who are seeing this webinar. So one voice and partnership are the two key concepts I have in my mind. Thank you.
And that is really important, highlighting importance of collaboration and partnership to help gain a wider reach, and that's really key. Roy, over to you.
Yeah, I mean, I would echo that as well, and I suppose add that. So, what we've tried to do as an organisation to promote World Suicide Prevention Day, is to develop a whole range of resources that people on a local and a national level can use. And so, for us, what's interesting when I reflect on World Suicide Prevention Day is, although we established it, it's like grown and grown and grown, so that it's obviously people in different countries all over the world have ownership over World Suicide Prevention Day. So it's not ours; it's all of our day. And when I think then about the things that we do and the resources we've developed, so if you go on our website, yasp.info, and if you go to the World Suicide Prevention tab, Suicide Prevention Day tab, there's banners. So if you're trying to promote it, so we've got World Suicide Prevention Day banners translated into 50 or 60 languages. We've established the cycle across the globe, this virtual cycle, which again is an activity anybody can do across the globe. And again, we've developed resources for that. And we've also developed other packs of information about how we should talk about suicide, how we should talk about suicide prevention, how we should tackle the myths around suicide. And actually, a big issue which we've been working in partnership with a whole range of people across the world is tackling the criminalization and trying decriminalization of suicide. Because sadly, we know there's different estimates. Some estimates suggest that in at least 23 countries across the globe, suicide is still criminalized. And we're working in partnership with colleagues again internationally to try and tackle that huge challenge that we face as a field. And often, World Suicide Prevention Day, many countries use that as a day to really shine a light on this absolute awful situation, this awful tragedy of suicide, but in those countries where suicide remains criminalized. And I'll just say one last thing, Joy, in response to that question, which is what we've done over a number of years now is we develop triennial themes around suicide and suicide prevention, specifically for World Suicide Prevention Day. So we're now in our current theme for World Suicide Prevention Day is around changing the narrative on suicide. And that builds on the previous triennial theme, which was working together to prevent suicide, as Akiyama also has mentioned. But with the changing the narrative around suicide or on suicide, again, we've got resources on our website, so and tips and supports on how you might try and embed that theme into your activities. And if I look at the activities across the globe, from Kenya to Brighton in the UK, or from to across Europe to places in Asia, there have been activities across the globe, looking at people using different tools from our toolkit on the website, but it could be events, awareness raising events. It could be launches by governments of a new strategy. Or, for example, one of the things we did for on YAS today is in partnership with Lancet Public Health. There was a whole series of papers on the public health approaches to suicide prevention launched on World Suicide Prevention Day. So it just shines a light. There's one day in the year, but it's vital. And again, locally, globally, we all can do something and use that day as a springboard for all of us to move forward in this challenge of preventing suicide globally.
Thank you so much, Rory, for highlighting the different resources that are available And I encourage all our participants today to please visit the website of the World Federation for Mental Health and the International Association for Suicide Prevention, so that you're able to access the resources and toolkits to help you in advocacy around these International Awareness Days. The next question is how are these awareness days set up to support advocacy locally, nationally, and regionally? So, Akiyama?
Yes, thank you. Uh, as the material of this seminar, as distributed by Global Mental Health Action Network, objectives of this seminar, yes, there are the we need to address. Uh, we need to develop grassroots campaign tailored to address local needs. It's imperative. So, to attain this goal as much as possible, WFMH, like WHO, we have WFMH regions. So, I am asking WFMH region leaders to work with WHO office to encourage the organization in the regions to come together, have an event, webinar, seminar to address the regional needs. I speak about the workplace mental health. About workplace mental health, yes, we know there are issues like primary prevention, education training beforehand, secondary prevention, early detection, and tertiary prevention to help prevent the relapse of people who return to work with mental illness. And as many of you may already know, WHO already published a workplace mental health guideline in 2022, and it's a very neat, comprehensive material which we can use. However, I wonder when we have global events, global information gathering, there may be issues like mental health of children who are put to work. There may be mental health issues for the NGO, NPO workers who work in dangerous areas like Gaza. Or there might be the issue of trafficking of labor force. Um, so global is global. Uh, there might be very different situations in the regions, and as much as possible, we want to gather information from all the events year long from various regions, and we can share, exchange information so that people in the region can better address their grassroots needs. Thank you.
Thank you so much, Akiyama, and highlighting the importance of working with the different regional um, WHO offices as well as regional partners to work together towards this awareness day, and also around grassroots interventions and advocacy around the same. Rory, over to you.
Yeah, so building on that regional approach, at the International Association for Suicide Prevention, there's probably three mechanisms I think which are important for us when we think about disseminating our messages and activities around suicide prevention and World Suicide Prevention Day. So it's not just specifically to World Suicide Prevention Day, but that broader challenge of trying to raise awareness about tackling the stigma around suicide, uh, raising awareness around suicide is preventable, and raising awareness around how you can prevent suicide. So, for example, it's in our sort of organizational structures. As I say, there are three things worth highlighting. So, one is that we have national representatives. So in each country, there's a national representative, and that national representative for YASP, part of their role is to be this conduit to either provide opportunities for where you can go to if you're looking for information around suicide prevention and suicide in your country. And again, that links to the World Suicide Prevention Day. They can hopefully help support you if you're thinking about organizing an event on the ground for World Suicide Prevention Day. We also, as an organization, have what are known as special interest groups. And these special interest groups, again, are often focused around specific topics. So it could be on social media and suicide prevention, it could be on suicide prevention strategies, it could be on male suicide, it could be on suicide in young people. And so, again, within the organization, there's these special interest groups which will have a chair or a co-chair. So again, members of YASP can avail of that knowledge from and again, those special interest groups are often involved in developing reports around particular topics, again, which can be used for World Suicide Prevention Day. And also, we have a whole series of dissemination events. We have a regular podcast series, which I currently host. We have a quarterly newsletter, dissemination of information. We have a wider webinar series. So there's lots of dissemination activities that anybody can access, broadly speaking. But if you're a member of YASP, and I would really encourage anybody who's watching this webinar and you're not a member of YASP and you're passionate about suicide prevention, please go to our website and find out how you can join the organization, because we need more members to genuinely tackle this problem. And then the last thing I would just say in terms of structures that we have, which are really vital, is that we've a few years ago we established a program of work called the Partnerships for Life work. And it was our attempt to really sort of at a strategic level, at a global level, to try and really tackle suicide prevention globally. And so what we've established are, using the World Health Organization regions of the world, the six WHO regions, we've established basically effectively working groups in each of those regions. And the aim of that Partnerships for Life is to establish an international collaboration of experts of all different backgrounds, policymakers, people with lived experience, clinicians, academics, all of us, to really think about how we can, in a more comprehensive and strategic way, really tackle suicide prevention, the needs of suicide prevention, which is often different in different parts of the world. And what's been remarkable about that initiative is really has it's really has grown messages around suicide prevention in areas of the world where we haven't quite reached previously. And I'll just say one statistic before handing back to you, Joy, and that statistic is that, oh, we've got a fire alarm test going on in my office. It's only a test. Oh, it's just stopped.
Attention please.
Oh, there we go.
Attention please.
That wasn't planned.
Fire has been reported.
There
in
is
the
no
building.
fire. There is no fire.
Please leave the building immediately.
I'll just get
by the nearest
I'll
exit.
just get this stat
Do
out.
not use the lifts.
It should stop. There we go. It's just stopped. Oh, it hasn't. The message is that if you look globally, 79% of the world's suicides happen in low and middle income countries. But sadly, most of if you think about research into suicide prevention, most of that still happens in high income countries. So what's been remarkable about Partnership for Life and the other work that we do as a global organization is trying to really reach the low and middle income countries where the vast majority of suicides occur. So apologies for about that fire alarm test intervention. Back to you, Joy.
Thank you so much, Rory. It's incredible to hear the vast structures that are in place to ensure that the regional networks are incorporated. And you've literally led us to the next question, as you mentioned, on low resource settings. And I'm sure there are many people who, you've talked of global, we've talked of regional, but there are quite a number of advocates who are in low resource settings, and they're probably wondering, how do they engage in both the World Mental Health Day and World Suicide Prevention Day activities? What can they do, and what are the opportunities for low resource engagement? So over to you, Akiyama.
Yes, this is an extremely important issue. And in the material, again, it is said that obviously there is a funding issue. in the low income, low resource countries. Um, this is this is half my personal idea because as a psychiatrist, I have developed rehabilitative recovery uh, program for people who want to continue working with mental illness and to prevent relapse while they are working. Because when you have mental conditions, it is possible that you have a relapse, and if you have a relapse, then it is not good. But if we if you can have a program to help prevent relapse, then people with mental illness can continue working. Um, as a catchphrase, I want to say that people with mental illness are are not the cost of society, but assets. There are in your country too, in Japan too, there are many people who work, who can work with mental illness. So they are contributing to society. They are assets of the society. Rehabilitative and recovery programs are not expensive. You need ordinary, uh, reasonable medical treatment, and you can have occupational therapy kind of setting. Of course, you need to provide psychoeducation, but these do not cost much. Or sometimes people may need improvement or work skill, but that can be done uh, not so expensively. So even in low resource countries, we can develop such rehabilitative recovery support programs. If people with mental illness can continue working, colleagues at workplace see that people with mental illness can continue working, then automatically it reduces the stigma. And back to the mobilization of financial resource issues. When the government realizes that people with mental illness can get recovered, can work, can contribute society, I have a hunch that they'll be better motivated to spend more money about the issues of mental illness. And when we receive the money, we can use the money for various purposes. Yes, work capacity recovery can be important, but it's not all. As we all know, there are many other needs and many other issues. But when we have some fund, we can distribute the money to fulfill other goals too. But first important notion is that people with mental illness are the assets of society, not a cost. This is my catchphrase. Thank you.
Thank you so much, Akiyama. And you've literally created a link showing how, from the rehabilitation to the workplace, and from the workplace up to how the government sees a gap and a need, and resulting in funding opportunities, which translate back to more activities. So I think one thing I'd like to tell our participants is, no matter how small, all activities that you do towards this day would help make the greater impact. And over to you, Rory.
Yeah, absolutely. I mean, small things can make a huge difference, and there's just to building on that. There's so many examples that even though suicide prevention, the scale of suicide prevention, in many respects, can seem so overwhelming. There's lots of examples of small acts of human connection can save lives, and I think it's reminding ourselves that what the central to all of our messaging around World Suicide Prevention Day or elsewhere is that we have to have compassion embedded throughout and tackle discrimination, inequality, the drivers of um, of distress and of that ongoing inequality which leads to suicide. I think we all can do something around that, and that's something we try to do when we look at all of our work globally and world suicide prevention activities. Um, Going back to your question, though, Joy, I think your question was about the low resource settings, and so again, just building on what I said earlier, is that I mean, given that the scale of the challenge is that this of whatever 79% of all suicides being in low and middle income settings, and so one of our things we were doing recently was we've just gone through a period in which we've been reviewing our activities and looking at our strategic planning over the next 5 years. And indeed, one of our key priorities is to redouble our efforts to work with partners in low and middle income country settings. And so when we're developing our resources, that's with that in mind. And indeed, over the years, we've developed trainings which are delivered in low resource settings, as well as working with partners to advocate for, as I mentioned earlier, decriminalization, which I think is one of the number one challenges globally to suicide and suicide prevention. Because remember, it's important to sort of remind ourselves that still in some countries you can still be. It's when we talk about criminalized, that people, family members can be bear the consequences if somebody engages in suicide or suicidal behavior, both financially as well as a person who engages, say, in non-fatal suicidal behavior can be put in prison still. There's still that stigma, that the barriers into help seeking. And so one of the challenges, Sam, when we think about changing the narrative around suicide, and our message is this year is really let's all work together to start the conversations around suicide prevention, moving from a narrative of despair to a narrative of hope. And there are many examples in low and middle income settings where there has been progress. Um, in terms of, we looked in like Ghana, for example, as an example of a country which is making progress, huge progress in terms of decriminalizing suicide. Pakistan's another country making great progress in decriminalizing suicide. And when I look at the conversations around suicide and suicide prevention and how they've changed in the 30 years that I've been working in suicide prevention, it's unrecognizable that we are having more of those conversations, but we've still, it's a long road ahead. And then as an organization, like in terms of our special interest groups, we have a special interest group dedicated to culture and suicidal behavior. Again, so that we can be much more culturally sensitive when we're trying to work in partnership, when we're trying to advocate for change globally. And again, I suppose that when I reflect on our understandings around suicide, our understandings around suicide have been too Western centric for too long. Now that's starting to change, but again, as I referred to that statistic earlier about the research evidence still is predominantly from high income settings. Now, in a related topic, self harm, which again we're involved in the International Association for Suicide Prevention, um, in the next week or around World Mental Health Day, the Lancet will be publishing the Lancet Commission on Self Harm, and I'm part of the executive team on that, and led by Helen Christensen in Australia and Paul Moran in England, and along myself, Paul, with Nav Kapoor as well. We've been this executive team, we've been leading this global initiative, which we published, say, in World Mental Health Day. And what's crucial about that, with regard to your question, for the first time ever, we're looking at self harm from a global perspective. We've got really incredible pillars of activity going on in that commission, looking at Indigenous peoples, looking at low and middle income settings, for the first time trying to understand genuinely through a culturally sensitive lens the challenges of self harm. And indeed, there have been other work that Dee Knight, a colleague in Bristol in England, and Nav Kapoor as well, and others have led work again looking at how we can look at suicide and suicide prevention through a Lancet psychiatry paper published a couple of years ago, again through this low and middle income setting lens. So I think things are moving forward, but we all need to continue to advocate for these sort of much more culturally sensitive approaches to suicide prevention.
Thank you so much, Rory, and it's great to hear of the progress around criminalizing suicide and some of the steps that are already being taken. And of course, more needs to be done, and that is why we'll continue to advocate, and we'll also look out for the Lancet series that will launch on self harm. And I think as we continue our conversation, I'd like to also move over to some of the questions from our audience. And one of the question is, how can we use advocacy and communication on commemoration days to unlock funding for mental health initiatives by grassroots organizations? Akiyama.
Funding, of course, has been a very difficult and important issue in Japan too, and we preach that we need funding for education, for social enlightenment, or research is important. But to be honest, probably two motives have worked. This is an example of Japan. Two motives have worked. One is negative, shameful factor, Roy. As you know, in Japan we had so many suicides, so many suicides when our economy was bad. So the government was put to be ashamed, and they had to use a lot of money to prevent suicide among the Japanese. At least partially successful. Now suicides have decreased to some extent in Japan, not sufficiently, but to some extent. But second, more positive motive is, as I said, uh, 20 years ago, Japanese government did not believe that people with mental illness can work. Mental illness can relapse any time. Then people with mental illness return to work, then relapse after 3 months. Then what is the use? Then mental illness, you can do nothing about mental illness. Such concept. However, including myself, many people worked in Japan to create a program that I explained, and now Japanese government understands that people with mental illness can work. They may not be able to work very hard, but taking their appropriate pace, they can work. And so Japanese government has put sizable amount of money to support the work capacity development and maintenance of people with mental illness. So, as I said, funding, hopefully at the later stage, government will understand the various needs about mental health, but you may first speak about recovery, rehabilitative opportunities and their contribution to the society. This is my personal thought. Thank you.
Rory, you want to add? Yeah.
Yeah, so if I go back to the question then, so can we use advocacy and communication on sort of commemoration days to unlock funding for local organizations? I suppose my message would be a practical message. To whoever's asked that question is, so we would be happy to support as an organization if to support you if you are trying to harness resources. So what we have is knowledge and evidence and experience, and I suppose what we could maybe support you with is the evidence of what works in different settings. So if you're trying to advocate for funding for a particular activity, we can help you build that evidence base or share the evidence of what is effective. And also we can advocate for the importance of this work, because I think there's another comment or question earlier about we need the permission to talk about suicide. and that's still the case. And I think part of that advocacy, um, especially in settings where we still are reluctant to talk about suicide, and that's both in high income as well as in low and middle income settings, is that again we can support you with that resources around how we talk about it safely, about these things in a safe and responsible manner, but in a way which hopefully will get you the sort of some sort of social capital support, that when you are going to governments or other funding bodies, that we can hopefully help you be support your applications or the like in the future.
Thank you so much, Rory, and once again emphasizing the resources that are available. So please do check out both the World Federation for Mental Health website and the International Association for Suicide Prevention website, as there's vast resources and that would be really helpful. Another question is, um, someone is curious as to know um, your thoughts on mental health education being organized in schools as a form of focusing on prevention.
Um, in Japan, luckily, after so many years, Japanese government decided to put mental illness as part of the health education for the high school students. Five disorders: anxiety disorder, eating disorder, mood disorder, substance dependence, and schizophrenia. Now, about education, there are two aspects. One is, indeed, as this person says, prevention. However, if we speak too much about prevention, it is as if people who could not be prevented are failure case maybe. But so I also belong to Japanese Society of Psychiatry and Neurology. Our society developed video of people with lived experience of five disorders to speak their experience of illness, treatment, recovery. Then, of course, students can understand the lived experience of the disorders, and they might think, oh, this could happen to me as well in 3 or 4 years. Then, how can you prevent such um, phenomena? Roy must have been doing these programs. To prevent mental illness, to prevent suicide, the strategies, enhancing communication skills, encourage people to speak about their difficulties, to share their intimate experience with the trusted others. These can be done, and this can be done as a general education. Uh, I think we think so. Our society focuses upon the video to educate high school students that in human society these phenomena can happen. But with some difficulty, people can overcome it, people can live with it, and we can learn from them. This is the message of the videos we have been developing. Thank you.
Thank you, Akiyama. Over to you, Roy.
Yes.
You muted,
Oh,
Rory.
Roy, you are
Oh,
muted.
sorry. I think I had it twice there. So just before I answer that question, just a quick comment that Sue Murray from Australia has made a really good point in the chat, which is just worth highlighting about relating to that, how awareness days can be important. And I think it's a great point, so worth just highlighting, which is, of course, an awareness days, if you're as an organization are involved in our case in World Suicide Prevention Day, that raises your profile of what you do and hopefully could start a conversation to a funder saying, actually, it's worth funding us because here's what we do. So I think it's a great point. Sorry, just worth I saw that Sue had made there. Um, Going on to the question then about schools and suicide prevention in schools, I'll talk about suicide prevention specifically. I think we need to be careful what we do in schools. Young people are obviously a vulnerable population. We know if we look at suicide rates are rare before puberty. Then when puberty happens, suicide rates increase. And in terms of the lifespan approach, the fastest increase you'll see at any stage in the lifespan is in adolescence, from puberty, teens through to your mid 20s. So we need to be careful. But it obviously highlights the importance of trying to support young people as much as we can in a school setting. So, to my mind, we need to be evidence based and evidence informed. And so, to my knowledge, the intervention which has clear evidence of its efficacy is a program called Youth Aware of Mental Health, or the YAM program. And the YAM program was tested in this European, I think 11,000 young people or adolescents in a randomized controlled trial led by Danuta Wasserman from Sweden. And the YAM program, which is this basically peer led intervention involving the young people themselves and talking about mental health. And that's been shown to be associated with reduced suicidal ideation, marked reduction in suicidal ideation, and also marked reduction in new cases of depression or depressive symptoms. So I would encourage anybody. It was published as part of the Saving and Empowering Young Lives in Europe, or the SAIL project. It's, if you Google SAIL, if you go to the Lancet, it was published in the Lancet a few years ago, the findings. I would encourage you there. That's what we should be doing, evidence informed, the SAIL YAM program. And then the other thing I think about in terms of suicide prevention in schools is my experience of speaking to lots and lots of teachers and other people in education is that they're really frightened themselves or anxious about talking about suicide or mental health. So part of the support then is also educating and supporting the teachers if they're going to work with this really challenging topic of mental health and suicide prevention. So it's really important that we support the teachers as well as delivering evidence-based interventions.
Thank you so much, Rory. And another important question is, how can people with mental health conditions use their own lived experience to advocate for advocacy and awareness spreading in global platforms? So, how can people with mental health conditions use their lived experience for advocacy? Akiyama? You're muted. Yeah.
Mental health phenomena need interpretation to be understood by people without such experiences. So you can certainly serve as translator, interpreter between the people who have experienced and who have not. Not only interpreters, people who have not had experiences. They want to know how they can live with people with mental illness, and they need advice, consultation. So you can be an interpreter and guide. And if you can connect people with mental illness with people without mental illness so that they can live together, it is, I guess, the most, not useful, most essential use of your experience. Thank you.
Thank you, Akiyama. Rory, anything to add?
Yeah, so um, lived experience and living experience has to be at the heart of everything we do. And it's remarkable that for so long, that vital, crucial, central voice was not part of research, was not part of policy, was not part of practice. Now, it's brilliant to see, in particular in this, I speak of the suicide prevention field, is that everything we do now is guided by lived and living experience. Because as Akiyama said, how can we understand this phenomenon without understanding from the point of view of people, those who are experiencing, in my case, suicidal thoughts or behavior, or those who are bereaved by suicide. And so what's is fundamental now in all that we do is we all of our activities are driven by lived experience. At the International Association for Suicide Prevention, and in all our activities, we've lived experience special interest groups, and those special interest groups are absolutely vital to making sure that voice is heard. And I think now, if I think even of funding bodies now, in research funding bodies in the UK and in other countries across the world, you have to have lived experience. But what's crucial is we support people with lived experience to engage in the best way possible and in a safe way. Now, in Scotland, where I live, um, as part of our suicide prevention activities at a national level. So, for example, we have a national suicide prevention strategy, a 10-year strategy. And in terms of expertise, it feeds into it. We've got an academic advisory group, which I lead. We also have a lived experience panel. And that lived experience panel is feeding into government policy. But what we've built around that, though, is support mechanisms. One of our mental health organizations is Scottish Action for Mental Health. They lead and support everybody, or co-lead everybody who's working on that lived experience panel to make sure that their mental health is protected, whilst to give us the best support and evidence to move things forward. And then just one other example, I had the pleasure and privilege of leading an MQ Mental Health, which is a research charity in the UK, and a Lancet Psychiatry initiative, in which we last year published a piece called "Gone Too Soon." What are the key priorities for action to prevent premature mortality associated with mental illness and mental distress? And we brought together, I think it was 40 people from across the globe. But crucial and central to everything we did was we had lived experience people, as well as policymakers, as well as academics, and as well as clinicians. And the emerging document, the publication published in Lancet Psychiatry last year, if you read it, it's been informed, everything is informed by lived experience. And again, if we think about, if we're going to prevent suicide, that implementation from evidence into practice is crucial. And for too long, that implementation gap has been vast, that what we've known about suicide prevention hasn't got out into practice. And part of the reason we have failed in that is because we haven't taken into consideration people's lived experience to understand, if you've got an intervention, will the people who need it use it? Is it acceptable to them? Is it tailored to their needs? So as we move forward in the challenge of trying to reduce suicide globally from that awful over 700,000 people every year, it's that lived experience lens I think is the game changer which has happened in recent years. Lived and living experience is crucial.
Thank you so much, Rory, for that incredible input. And there's great questions in the chat. However, time is not on our side. So maybe as we it would be great to get some key takeaways. And I'd like to ask our panelists to complete the statement. To drive meaningful action on International Awareness Days, we must. So over to you, Akiyama.
Yes, we must enhance, provide rehabilitative and recovery support programs to make society realize that people with mental health conditions are assets to the society and not cost. Thank you.
And me, so I would say we must listen and hear, crucial distinction, listening and hear, and engage with everyone involved in suicide prevention. And that is people with lived experience, policymakers, clinicians, academics. We all have a crucial role in moving the conversation forward and preventing suicide. Joy, have you frozen, or can you not get out? Can you not get your
Joe,
chat?
you are muted.
You're muted. Technical difficulty, Joy, is it? Yeah. Well, just whilst Joy is trying to deal with the technical difficulty, I just note there's a comment or a question about discussing suicide, and just to remind everybody that as long as we talk about suicide in a safe way, and asking about suicide does not plant the idea in their head. It's really important that we all start those conversations. And again, it's something that the International Association for Suicide Prevention that we try to do is try to encourage safe conversations around suicide. That's how we tackle stigma. If we tackle stigma, we can move forward in saving people's lives. And hopefully Joy is back now. Joy, can you? No, Joy, no. Still Joy, still can't.
Yeah. Then, yeah, while waiting for Joy, as we all know, suicide is the worst outcome of poor mental health. So there are many mental health issues. We need to work on it, but all our effort should be led to, should be connected with the efforts to suicide prevention. So, in that respect, as I said in the beginning, I'm happy to speak with Roy at this seminar, and hopefully our various activities get connected. Thank you, Roy.
Thanks, Akiyama. And I just want before, in case Joy doesn't get back in, just to highlight that this conversation will end in a couple of minutes' time, but just to remind you that the conversation will continue on Circle, and the link to join will be put in the chat. So I'm assuming the link to join the Circle will be put in the chat. And again, just to remind you that there are resources in both of our organizations online, and hopefully those resources will help us continue to grow World Suicide Prevention Day, World Mental Health Day, because I think all of us have a role to play in suicide and suicide prevention and promoting and positive mental health and tackling mental illness. And hopefully, Joy is now back.
Yes, thank you so much, and apologies for the technical difficulties. But I'd like to thank everyone for joining us today, and thank you to the panelists for such an incredible session. We've clearly learned a lot. People are an asset. People with mental health conditions are an asset to society, and compassion goes a long way. So just remember to be kind. You never know what people are going through. So always be kind. And even as we progress, I'd like to say thank you so much to our panelists. Thank you to our participants for joining us today. The Global Mental Health Action Network will be launching a new advocacy guide, and that will it will launch, and it will be available from tomorrow, and it will be shared to all those who've registered. The next session on the webinar series will be on the 14th of October as they launch their strategy. So be on the lookout for that as well. And just want to say thank you all, and have a great rest of the day to everyone. So thank you so much.
Thank
Thank you. Bye
you.
bye.
Thank you. Bye bye.